So we are joined by the fantastic Ember Maselli, MSW. Ember is a social worker, researcher, and trainer with over a decade of experience working at the intersections of domestic violence, mental health, and substance use. Ember has conducted and supported mixed methods research, evaluation, and training initiatives to inform healthcare, social services, education, and public policy. Ember leads with survivor-centered, peer-led approaches with a focus on equity and accessibility. They have a special interest in disability justice, traumatic brain injury, and people with lived experience working in the DV movement. Ember holds an MSW from Florida State University and lives in Chicago, Illinois, with her daughter and two dogs, two beautiful dogs. Um, Again, if you have any questions, please feel free to put them in the chat box. Thanks for joining us today on Domestic Violence and People with Disabilities, Part 3, What We Can Do. Without further ado, I'm going to turn it over to Ember.
Thank you so much, Erin, and thank you, Bianca and Frankie. Thank you, everyone, for being here. As Erin said, my name's Ember. I am a domestic violence advocate, social worker, mental health advocate, survivor, person with disabilities, all sorts of different things. And this is the third part in our series about domestic violence and people with disabilities. Um, like Erin said, if you missed a little bit, if you weren't able to be here for parts 1 and 2, we'll do a little bit of catch up, and also those are available on their website for you to see. Erin already read this to you and gave you a great introduction. They're my two beautiful dogs, Punk and Odie, and then my daughter, who Erin did not include a little superlative about, and Ara will hear about that because she knows Erin and won't be super no, I'm kidding. This is me and my dogs and my daughter. We live here in Chicago. Um, it's beautiful, lovely. This is what I look like. Um, so what are we going to talk about today? Today is a bit of a tough um presentation in this series, not because it's necessarily heavier or more complicated, but because there's so much. And so this is kind of the part where sometimes people who I'm working with, people who I'm training, people who I'm working on projects with, this is kind of the spot where people start to worry because there's so much information and so much going on, and people kind of don't know what to do with all the new information that they have. So, what I want to do today is just review a little bit about domestic violence, reviewing domestic violence and disability, talking about that intersection that we talked about last time, about how people who are experiencing domestic violence who also have a disability, there's this extra kind of layer of barriers, supports, strengths, needs, all sorts of things that are just part of what it is like to be a person with a disability. All of those things affect what it's like to be a person who's experiencing domestic violence. We're going to talk about that. And we're going to talk about this social ecological model, which sounds very academic, and it is kind of very like psychology 101 type stuff, but I think it's important to help us figure out who we are and how we interact in our systems to help us figure out what to do with all of this information. So we're going to learn about prevention, support, and services for survivors of domestic violence who have disabilities. And it's going to help us kind of understand how we can support people with disabilities who are facing domestic violence. We're also going to talk a little bit about like who we are in this conversation, like who we're bringing here today to the presentation. You may be coming as an advocate, as a community member, as a person with disabilities, as a caregiver, as someone who receives care, or you may be more than one of these things. So we're going to talk about all of that and how that can overlap. And so these are the 4 topics that we've talked about in the series. So we started out with talking about prevalence and types of abuse in March. In April, we talked about dynamics and the barriers that are there from the systems. Today, we're talking a little bit about what we can do. And then in June, we're going to wrap up this series talking about building connections, answering some questions, and doing some follow-up. So it's intentionally a little vague because as I'm going through kind of doing these presentations and developing them as we go along, kind of filling them up, trying to make them more relevant for you all. There are things that I'm noticing that I want to talk about that I can't, so I'm including those in there. And then anything that you all have that comes up, if you want to email me, reach out to Erin or Bianca or Frankie. They can also forward that information to me if there's something you want me to talk about specifically. That's available there. Just some notes. I'm going to blast through this because we've talked about it a little bit before, and there's not as much of this time because we're talking more about prevention and support and services rather than abuse and those dynamics themselves. But for language, I primarily use the term survivor to talk about people who have experienced domestic violence, people who are currently experiencing it, people who've experienced it before, or maybe people who are experiencing abuse but maybe aren't ready to name it. Other people may use victim. People may talk about abusive partner, saying abuser, abusive partner, perpetrator, batterer, all sorts of words like that. I tend to just use abuser or abusive partner. When talking about people with disabilities, I will use the term people with disabilities or disabled person interchangeably. I use both person first and identity first language for myself, but tend to use person first language when doing presentations like this. So sometimes I slip into identity first. That's more about me. So there's that. With gender, we're not going to talk a whole lot about gender dynamics today, as we have in the past, talking about how the majority of survivors of people who experience violence are women. The majority of people who we know perpetrate violence are men, and there are power dynamics within that. We also recognize that men and women are not the only two genders that exist. There are gender nonconforming people, non-binary people, trans people who maybe don't fit as neatly into those boxes, as well as relationships that are not just heterosexual. So we know that abuse occurs in all sorts of relationships to all sorts of people, but I'm primarily going to talk about women as survivors using that language again because that's also what's in the data. As we've talked about before, data is very difficult to find about domestic violence that is accurate and up to date. A lot of that's done at the federal level, so there's some complications there right now. It's also just generally difficult to find this information, so a lot of it is underreported, aggregated, so it's all kind of lumped together. We can't kind of see what different people are experiencing differently because we're just getting, the number of Americans or people living in the United States or people living in North America. We're not getting little details. So just something to consider as we move through. So I also want to make sure you're taking care of yourself. As I said, this might give you more questions than answers. You are more than welcome to put questions in the chat. If you want to message, I don't know if you can message me directly, but you can likely message one of our self-advocacy project folks that way, and they can relay that to me if you have a question you'd want to ask in private, or my email is also in the chat, and it's in the slides, and I'm sure Erin will pop it in at some point. So you're more than welcome to ask those questions to me, but also it's okay to hold those questions because a lot of this is kind of thinking about bigger ways that we can affect change, that we can strengthen our community's response to domestic violence, that we can help peers, and also that we can help ourselves and advocate for ourselves as people with disabilities who may have experienced abuse in the past or be concerned about it in the future or are working through something right now. So I just want us to think about that. Okay. Sometimes when I click next slide, it just doesn't. Okay. So I want to review the definition of domestic violence one more time. If you've been here, this is your third rodeo, then this is old information. But if you're new, it's new information. And I think it's helpful just to remember some of these key things that we're talking about. So when we talk about domestic violence, we're talking specifically about a pattern of intentional behaviors that are intended to assert power and control over a partner or a former partner. The majority of what I've been talking about has been domestic violence between intimate partners or former partners. So people you've dated, boyfriend, girlfriend, husband, wife, spouse, ex, father of your children, whatever. People who are like in your life in that intimate way, intimate partner violence. There can also be caregiver violence, which can overlap with domestic violence because sometimes caregivers are living in the home or they're kind of serving two roles. Maybe it's a partner who's providing care or a parent or a family member or something like that. So sometimes the boundaries of this get fuzzy, but I just want to really focus on remembering that it's this pattern of intentional behaviors that are all about power and control. That's kind of the important piece of what we're talking about today as well, is just having this basic understanding of domestic violence so that we can be supportive. So, when we talk about abuse tactics, I like to think of abuse tactics as locks on the door that keep somebody stuck in an unhealthy or an abusive relationship. Typically, when someone enters a relationship, there's maybe one or two locks on the door. Most people don't come into a first date or, the first time that you're meeting somebody somewhere, kind of showing all of their red flags, expressing the views that they have that may be harmful to you. They don't typically come out violent or using these tactics right away. They're things that can ramp up. So things that we may think of first when we think about domestic violence are things like physical and sexual abuse. So this is like causing physical harm, causing sexual harm, or threatening to do any of those things. It doesn't necessarily have to be um, actually causing physical harm, but it can be the threat of that. So the threat of hitting, the threat of using weapons, things like that. Something that I experienced a lot. I grew up in Florida. I grew up in parts of Florida that were more like New England, and I lived in parts of Florida that were more like the South. And so different cultural norms and ideas where somebody could be sitting on their porch cleaning their gun because that's how they maintain their firearm that they own. And that can be like a very neutral, normal activity. And I've also worked with a survivor whose partner would bring out his gun and clean his gun as an intimidation tactic. And so this is not only emotional abuse, but this could be turned into physical abuse very quickly. That threat of physical abuse is there. These are the locks that are being added on the door. There's financial abuse and isolation, not allowing people to see their family members, to see other people, to talk to doctors or teachers or their friends and people in the community. It's much easier to keep all the locks on the door when there's not somebody to help unlock them, right? There's not somebody out there to say, hey, I think maybe, I'm worried about you. You haven't seemed like yourself. I'm worried about the injuries you have. I'm worried about how so and so is talking to you. Isolation helps prevent people from breaking through these locks to help somebody who's trapped inside. We also see things like spiritual abuse, using their religion or their healing practices or cultural practices against them or not allowing them access to them. Stalking and cyber abuse. So this can be a lot of different forms of abuse that happen through cyber stalking, cyber bullying, identity theft, things like that. Any kind of abuse that can basically be leveraged on a computer, which is a lot of different types of abuse. And then a big one we see for people with disabilities, especially, is restricting access to care. A lot of times this can be restricting access to therapy, to counseling, to like chaplain services, spiritual services, things like that that can help with mental wellness. It can also include restricting access to doctor's offices, to social outings that help that person improve their mental or physical well-being, preventing them from going to 12-step meetings, things that can affect sobriety, things like that. So the range of abuse tactics is very large. And I just wanted to make sure that we spent a little bit of time reviewing that because when we start talking about what we do when we're faced with these things as an outsider or as someone who's experiencing them, it can get really complicated really fast. So having a good foundation can be helpful to keep us all kind of calm and focused on what's important in that moment for the person we're helping or for ourselves before we move forward. So again, we talked about some of the dynamics of abuse that happen with people with disabilities. A lot of this has to do with leveraging that disability as another way to cause harm. So withholding medication or treatment, withholding or damaging accessibility devices, things like wheelchairs, walkers, deafblind communicators, any kind of accessibility device, restricting accessibility to society, language, family, or friends, threatening to institutionalize or hospitalize them, trying to physically overpower or harm them, using societal stigma against survivors with disability, or using mental health or substance use coercion. So using somebody's mental health or substance use, whether it's real or imagined by the abusive partner or not, to overpower them, say, to keep them from calling for help or to keep them from feeling like they can go to the doctor because, Well, the doctor will find out you're using drugs and you're going to go to jail. Or, if you start going to counseling, they're going to realize you're crazy and take the kids away. Lots of different ways that mental health and substance use coercion can show up here. As we talked about before, people with disabilities are more likely to be abused by a partner than someone without a disability. People with disabilities report more severe physical abuse than those without a disability. So they're often experiencing more severe, more violent physical abuse than somebody without a disability. So these can both exacerbate and cause new medical conditions and disabilities. Um, and studies have found that about 80%, so this is 4 out of 5 disabled women, have been sexually assaulted. And the majority of those sexual assaults were by an intimate partner. So this is something that is very important to consider when we're talking about 4 out of 5 disabled women being sexually assaulted. When we're talking about what we can do to help, knowing this information is really helpful. Knowing that people with disabilities may experience more physical abuse. These are important things to know. So as we're going through this, just having I want you to remember, if you're starting to feel that kind of helplessness or feeling overpowered by how negative and how severe all of this feels, is that the more we know about how to help people with this, the more we know about people with disabilities and their experiences with domestic violence, then the more able we are to help. And what that helping looks like can be a lot of different things. So we're going to talk about that. Some important notes that I wanted to talk about today. This one slide could be a 1, 2, 3 hour conversation. And I am tasked with putting it right here in maybe 2 or 3 minutes to make sure that we can kind of set the stage for answering this big question of what we can do, how we can help. What do we do when we're faced with someone we know experiencing violence, or maybe us ourselves, we're worried that the relationship that we're in is becoming violent, or we're worried about talking about a previous relationship that maybe there aren't any current safety concerns, but we're still dealing with it in our heads. It can be a lot. So before we talk about what we can do, I just want to talk about a couple of things, which one is that victims and survivors of abuse are not to blame for the abuse that they've experienced. A lot of data, a lot of training, a lot of education on domestic violence will talk about risk factors or things that can make somebody more likely to be taken advantage of by an abusive partner. And sometimes this can turn into, well, if you weren't so dependent on this person because of your condition, this wouldn't have happened. And that is not how domestic violence works. That is not how caregiving should work. Abuse is the fault of the abusive person. That's it. There are things in our society that make it easier for people to abuse. There are things in our communities that make it easier for abuse to happen. There are relationships that we have that may open us up to vulnerability. And there are things about individuals that may make them easier targets for an abusive partner. But none of those things are the fault of the survivor. And none of those things are things that we should be ashamed of if it's something that we see in ourselves or in people that we love. These risk factors or traits or things that are associated with abuse are not our fault. Abuse is the fault of the abusive person. I just want to emphasize that. And then I think that we have a responsibility as members of our community to prevent abuse, support survivors of abuse, and connect them to adequate support and services that they want. So that's kind of the end goal of all of this, is for me to feel like I'm sharing what folks need to know and can know about domestic violence and about people with disabilities, and how that gives us the strength to be a supportive person, to be involved in preventing future abuse, and to also be a part of our community as we kind of make it a safer place for people with disabilities and for survivors of domestic violence to live. And there's lots of different ways that we do that, depending on our role, depending on how we sit within society and where we are. So it all just depends on kind of how we are situated. Oops, goodness gracious. Okay. So usually we're about halfway through. Okay, I'm doing okay on time, 1:20. I feel like I'm going fast, but we'll be okay. If I'm talking too fast, please let me know. You all are mostly East Coasters, so it should be okay. When I'm here in Chicago with these Midwesterners, they are constantly telling me to slow down. So if I need to, please let me know. But otherwise, I'll keep going. But I just wanted us to take a breather, stretch, see if anybody had any questions. If you have questions that you want to put in the chat, you can do that. I'll kind of address them as we go through. If I feel like I need to take more time at the end, I'll do that. So if I skip a question, I'm not ignoring you. I'm just trying to work within the confines of this lovely Zoom that we're in. So, and you can also enjoy a picture. I took this in my hometown in Indian Harbor Beach, and the little moon's up there. And if I had a fancy camera, you could see the moon better, and you can't. But this picture helps me relax, so that's why it's here too for me. All right, I'm gonna keep moving. You put those questions in if you have them. Oops. Oh, goodness. One day I'll get the slides right. Today's not the day. Okay. So first, before we're talking about what we can do or how we can help or how do we respond, I just want us to think about who we are right now on this call. There's 19 of us. So some of us may be people with disabilities. Some of us may be advocates for people with disabilities, whether that's a formal advocate, maybe we work for some sort of disability advocacy organization, or we work in a social service org helping people with developmental disabilities or mental health disabilities or substance use related disabilities. Or we may just be advocates who are, fierce allies and friends with folks in our lives who have disabilities who we can be supportive for. We also are friends and family of people with disabilities. Some of us may be social service providers. You may be a therapist, a medical provider, a first responder, or you may have people who do those jobs in your families, medical providers, and we're all community members in some way. We're all a part of some community. We're a part of our communities, like literally our neighborhoods. Whether you engage in that community depends. I don't talk to my neighbors a whole lot, but some I talk to a bunch. It really just depends on what the vibe is like, and these communities are also constantly changing, so our role is always changing depending on what part of ourselves we're kind of being that day. So today I don't feel as much like the person with disabilities. I feel more like the advocate, and I feel more like the social service provider. But I am also friends and family of people with disabilities. I am a community member. I'm all of these things basically except a medical provider. I haven't gotten there yet, but maybe, probably not. It seems scary. Um, but I have watched Grey's Anatomy for 22 years, so I might be almost there. So let me know. But I just want us to think about who we are within the context of asking this question of what do we do now that we know all this about domestic violence? We know that it's a big problem. We know that it's happening to people with disabilities. We know that it's happening in our communities, in our state, in our country, around the world. We know all of these things. So it's hard to figure out what we do next. So again, I'm going to get a little textbook on you all and talk a little bit about a social ecological model. So this is a very fancy, very formal way to just talk about how we move through society. So how I think of it, I was looking for a better image and I couldn't find one, so you'll have to work with me. But if you imagine yourself as the individual, you're in the middle. So let's imagine we're just like in a round room or in an open space, and you're in the middle of that circle. And so who we are, our individual traits is made up of who we are biologically, medically, our personal history, our age, education, income, if we use substances, if we have a history of being abused or causing harm, if we've ever caused harm ourselves, about our race, our religion, our socioeconomic status, how much money we have. These are all individual factors about ourselves. Some of them change. So, like, your disability can change, your medical history can change, your age changes, your education level can change, your income can change. And some things are more stable. Your race, your ethnicity, your nationality, immigration status, things like that are a little more static. They stay the same. So that's who we are in the individual. And then I want to imagine you to imagine a bigger circle around you. And this is kind of the relationship area of things. So this is kind of all the people in your life that you're talking to pretty regularly. These are your peers, your partners, your family members, your kids, coworkers, your neighbor next door, the person who sells you your coffee every Saturday morning, um, just the people who you have relationships with, or people that you no longer have relationships with for some reason. Those kind of all exist in this realm. And then we have the community. So this is this third circle around you, a little further out. These are things like your schools, workplaces, hospitals, neighborhood organizations. This is kind of the context where relationships happen. So, where are the spaces that relationships are happening? Are they happening at church? Are they happening at school? Are they happening at work? At coffee shops, at the library? This could also be like in AA meetings, in support groups, in any kind of group activity you're doing. This could be like your recreational hockey team. This could be anything. Um, and then the biggest part we have that kind of encompasses everything are all of the societal factors. So these are really broad social and cultural norms. And when we're talking about violence, a lot of these maybe support violence or reinforce that violence is okay. I think about the communities where I grew up living in Florida. Um, it was very kind of white Christian because that's who lived in my communities and that's who had the power in my communities. So those are the kind of things I saw, which is like a mom and a dad and two and a half kids and a white picket fence, and dad works and mom cooks and cleans and everyone's happy. And that is a vision of society that can be perfectly fine and happy and lovely if it's that person's choice. And so this is where the societal factors can sometimes, again, we think of the door locks on that lock of abuse. Sometimes society is a lock and sometimes society is a key. And so it just depends on how we relate to our society. Same with community, same with our relationships, and same with our relationship with ourselves. Sometimes our relationships within all of these areas can help us or hurt us, either because of how we're interacting with the environment or how the environment is kind of giving back to us and the people in that environment are giving back to us. So I know this is a lot to think about, and I promise that there's kind of a point to thinking about it this way. But I briefly kind of tried to map out some of these things just so you could kind of see what kind of things I'm talking about. So we have like on the left is me as an individual, kind of some things about me. I'm just a weird, gender non-conforming, short-haired, tattooed mom. Um, and then, that's kind of who I am, the roles that I hold, how I feel about myself. Um, I don't have a lot on here about like religion or my background because those things weren't super, they didn't come to the surface when I'm thinking about who I am, what makes me as an individual. And for other people, that may be the top of their list of what they think about. To me, being a mom is kind of at the top of my list. Like that's what I think about the most. And that goes into my relationships where you can see that my relationships with my daughter, with my friends, with coworkers, and like with other mom friends and my friends and our kids who are friends. Um, and my community, a lot of my community is around my daughter's school. My workplace is right here. You all are in my community right now. So we can see that. I'm a part of some like immigration and queer support networks in Chicago. Um, that's kind of my larger community. And then there's the societal factors, like what it's like just growing up in a country where healthcare isn't universally accessible. What it's like living in a city like Chicago that's very progressive compared to where I grew up, what it's like to, just like interact with society as an adult compared to when I was younger. All of these things are kind of constantly in ebb and flow. Some of them don't really change, but the way that we interact with all these things changes. So I'm going to move forward. And so I want you to be thinking about kind of your place as an individual and the community and the relationships and the societal things that affect you. I want you to be thinking about that in the back of your mind because now I kind of want to go back to talking more about the what do we do. So we kind of talked about the who are we, and this is kind of the like what can be done. And when we talk about what can be done, I'm talking about prevention, support, and services that aim to strengthen our response to domestic violence, to support and provide safety for survivors of abuse And specifically, we're also, remember, in the back of our minds thinking about what this means for people with disabilities, because like I said, that's that added layer of new factors. Having a disability changes who you are in this individual space. It changes the way your relationships work and how the community views you and how society views you, what's available to you financially, physically, emotionally, spiritually. All of that is affected by disability, just the way that it's affected by being a survivor of domestic violence, as it is being a mother or being a dog parent or being a runner. All of these things change the way that we interact with our environment. And so, when we're talking about domestic violence, we're going to talk about prevention, support, and services. So, I'm just going to define these kind of broadly to give us a better idea of like what are our options when we're thinking about what do I do? How do I become a part of making things better for survivors? Whether that survivor is yourself or someone in your life or someone that you work with in your capacity in social services or as a medical provider or as a neighbor or someone in AA with you. So I just want us to think about that. So prevention, pretty simple. These are things to reduce the occurrence of domestic violence. So a lot of what we see with this is promoting healthy and respectful relationships. A lot of education for young people is where this tends to be focused. Educating people of all ages and backgrounds about harmful relationship behaviors is very helpful, and creating protective environments and policies for survivors so they can share their experiences safely. Because the more we know about domestic violence, the more we can do to create a society that rejects that form of violence. And it also gives us an opportunity to hear what individuals need when we're creating environments where they can share openly. And we also want, prevention also includes engaging ourselves, families, and communities in violence prevention efforts. So prevention is kind of like the first stop where a lot of people go. And I think we're all on a really good pathway to prevention now because we are talking about healthy and respectful relationships. We talked about that in part one. We talked about kind of this spectrum of healthy and unhealthy and abusive relationships. We've been talking about what behaviors can look like specifically for people who have disabilities, that the abuse tactics can change or look a little different. And we can, the more we know about domestic violence, the more that we can do to help if someone in our lives comes to us or we see them and we say, hey, I saw the way Sean was talking to you and I really just don't like the way he's talking to you. Like what he's doing is not okay. It's making me feel worried about XYZ. You deserve care and respect, It gives us kind of the knowledge and the information we need to start having those hard conversations. And that's when we get into support, right? So support are efforts to provide safe and non-judgmental spaces for survivors. This can be really small things like just listening, being non-judgmental, not blaming someone for what happened, not using accusatory language. It can also be initiating that conversation. We talked about, I was just saying, how to bring up to somebody, after seeing you and Brad talk about, after dinner about who was going to pay the bill, does he snap at you like that a lot? Because it made me feel really worried to see him talk to you that way. So being able to open up a safe, non-judgmental space for someone to talk about it can be really important. And there's ways that you can have conversations that make it easier instead of just saying, why would you let him talk to you like that? Well, what did you do to piss him off? Or there must have been something going on. Asking a lot of why questions. Why did this happen? What did you do to make this happen? How come you didn't tell me about this sooner? Asking questions like that are kind of interrogating are often not helpful in support. For support, we're really focusing on listening and caring. We're not looking for solutions or fixing things. And I think that's a really big takeaway from this is that there's not like one magic phrase to fix this. There's not something we can say that reveals that abuse is happening and provides a pathway to all the solutions a survivor needs and gives them the mental and spiritual and physical energy to be able to do those things. A lot of what we're doing when I'm talking to people about how to be supportive is just not making it worse. Being a place where someone can say everything that they're feeling and not feel blamed for what's going on. They're having a private, a conversation where they can talk about it in private. And maybe it also gives them the opportunity to feel like they can reach out for help when maybe there's more safety concerns. Um, and supporting someone doesn't mean that you say, you can come live in my basement. I've made the bed. I ordered food. I got a pack and play on the way. You're not just housing people. That's not all support can look like. Support can be having the conversation. Increasing safety can be, do you want to keep an extra set of keys at my house in case you need to get out quickly? Or do you want to keep copies of your kids' birth certificates at work? Maybe that's a better idea. Just like little ways that you can brainstorm with people about increasing their safety in ways that don't focus on complete safety and isolation from an abusive partner, but focus on what that person actually needs in that moment. um and services are a big help when this happens, because sometimes when you are talking to somebody, you feel like you're trying to provide support, but suddenly you're a little in over your head. You don't know how to address all the things that are going on with this person that maybe you're close to. Is a family member, is a client, is someone in a support group that you're in, is in your volleyball league. um I'm not, no one expects anybody to be the expert on how to have all these conversations, but knowing that there are services available to increase safety and address physical and mental health and provide survivors with basic needs and healing needs, that can be really helpful. Knowing that there's shelter, safe housing, food, and basic needs available, that trauma-informed, DV-informed services are available, that there are community resources that are accessible and helpful for survivors with disabilities. Knowing that these things exist is helpful. And sometimes, depending on where you live, depending on who the powers that be are, some of this is harder to access. Finding shelter can be much more difficult in rural areas. It can be much more difficult for people with disabilities because not all shelters are accessible. Even if they are wheelchair accessible, they may be inaccessible in other ways. There may be physical accessibility issues. There may be too many rules and regulations on people staying in shelter that are just not doable for someone with a disability. There may be work requirements that aren't flexible for the needs of someone with a disability to stay in services. So just because services are there doesn't mean that they're good. And so this is another part of that, which is making sure that these services are trauma informed, they're DV informed, they're accessible. So really making sure that those services are available for everyone who needs them. So that is all a lot about prevention, support, and services. But I want to kind of talk about what the goal is when you're talking about domestic violence and people with disabilities, or talking with someone who has a disability who's experiencing domestic violence. Is the goal of that conversation is to express support, offer safety, that you can, and listen. No one is asking you again to clear out, the extra bedroom or to put yourself at risk for helping someone. But even just having these basic conversations can increase safety. Listening can increase that person's safety because now they know they have more support options. They have someone else that they can listen to. They have somewhere that they can turn to if they don't know what to do. And that is so essential. Um, Another thing to remember is that survivors are the experts on their own experiences. Many survivors have been with their partners for years or even decades. My longest relationship was 12 years, and that was an abusive relationship. And I knew my partner better than anybody else did because I had been in a relationship with him longer than anybody else had. I had seen what he was like day in and day out. And survivors get to know their abusive partners. They get to know and they get to assess their own level of risk and safety. And what may feel safe to me or you right now in May of 2026 may be different than what felt safe. Just example, like when I was a college student, what felt safe to me is much different than what feels safe to me now as a parent. And what feels safe to someone who's living in an abusive situation is going to feel different from someone who is not, or someone who never has. Um, survivors, especially survivors with disabilities, particularly with disabilities, are often discredited, ignored, they're not believed, their experiences are minimized, or they're treated like children. Um, some people with disabilities are not even treated as survivors of domestic violence because some there are stigma and societal beliefs that people with disabilities can't be in relationships consensually, especially people who maybe have developmental disabilities or disabilities that are more visible than others. Um, the goal when we're talking to people about domestic violence is to believe them, to listen, to validate, and empower them. And if we're assuming that people with disabilities who are survivors don't have the ability to make their own choices, we're taking away more control. We're exerting more power over them that their abusive partner has already done. Um, so that's something I just like to reiterate. Also, no one has all the answers. It takes the entire system to prevent DV, to support survivors, and change our culture with services and interventions. There's not a one-stop shop that's going to quote unquote fix someone or make them safe or make them realize that they want out of their relationship or um, give them the money and the freedom and the legal remedies that they need because it's just not that simple. It's very complicated and no one has all the answers. So, again, I say this because when we're talking about this with someone, the goal of the conversation isn't to fix everything. It's to express support, offer safety where we can, and to just listen. Um, Practice makes it easier. The more you talk about difficult topics, the easier it becomes. When I first started working in a shelter environment, I had previously worked with students who experienced crime. Most of that was like property crime, theft, but also sexual violence. But my first real jump into domestic violence was working in a shelter environment. And there were 100 women and children living in the shelter at any given time. And I would also meet with about 40 people a month in the hospital. And so at first, it feels very difficult to start having conversations about difficult topics. And as time goes on, it becomes easier. You become more comfortable having the conversations. You realize areas where maybe you could have done better or areas where, someone gave you good feedback about how you were talking about this issue. This isn't just for people who get thrown into working into a 100-bed shelter fresh out of grad school. This is also what it's like having any kind of difficult conversation. It takes time. I grew up with, we don't talk about religion or politics at the table. A lot of people also don't want me to talk about my job at the kitchen table, and that's okay. Whoever's table I'm at, I'm going to respect that. And I also try to make it very normal to talk about difficult topics because it normalizes it. It brings it out of the dark. It shines light on it and makes it easier. And so also the more comfortable you get talking about things like this, the more comfortable your peers will get. Um, and that's great. And a big thing again is connecting survivors with resources for support and services. So, you know, safety planning. This is a service that someone can do over the hotline, whether that's the National Domestic Violence Hotline, the New Jersey Hotline. There's sexual violence hotline 988, which is the mental health crisis phone number, law enforcement, domestic violence advocates, court advocates. All of these folks tend to have training on safety planning, which is what it sounds like. It's a plan for safety for that survivor. It's not a guarantee that they will be safe, but it's a guide to help them navigate things that may come up within the next day or two or three, depending. That can help them navigate that. Counseling and therapy or other services that you can help connect survivors with mental and physical health care, accessing benefits and welfare, having access to health insurance, and then education and support for survivors, their families, and people with disabilities. So you don't have to fix everything, but knowing how big this kind of Pandora's box is now that we've opened it, now that we started talking about domestic violence, talking about the prevalence, how common it is, about the tactics, about what it looks like for folks with disabilities, how those tactics change, how people with disabilities are at such high risk for domestic violence and violence from partners. Once we learn all of that, we kind of see how we can integrate these ideas of prevention, support, and services into the different relationships that we have in our lives. So for me, I do a lot of prevention through education, training, things like that. And that happens to me. I feel that happening, in myself because I'm always learning more. And I came to realize my relationship was abusive when I was already working in the field for almost a decade. So I'm always still learning, and you're always still reflecting on how those things I knew, how they impacted people in my community and in society. You see how they affect you. Um, there's also ways to provide support. Um, being non-judgmental with yourself, giving yourself space to not shame yourself about your experiences, whether you're currently experiencing abuse or it's something that's happened in the past. That can happen at the individual level. And it can also happen at the community level or the relationship level or the societal level. There's lots of different ways that we can do this. Services is another big one. A lot of these are happening at the community level and societal level because these are things that require community to meet all of the needs that survivors have. The number one thing that we hear from survivors that they need help with, besides getting away from someone who might be trying to hurt them, is having their basic needs met. This is food, transportation, childcare, jobs, housing, just the basic things that people need to live and that parents need to live with their children. Um, and so these are things that we can see how services can help at the individual level. Individually, I can decide that maybe I need to take another step in taking care of myself. So maybe I'm going to start seeing what my relationship is like with therapy. Maybe I'm going to start having more conversations with people in my life about what services are available to them or how they might benefit from something or how it's okay that they experience something terrible and they deserve to heal from that, whether it's through therapy or medication or support groups or spiritual practices or a combination. Um, and then, there's other things that I haven't included on here that fit in, though, like making policies about what your organization allows and doesn't allow, how accessible domestic violence shelters need to be. If organizations that are working with people with disabilities are screening or talking about domestic violence, if domestic violence education is something that's happening for folks transitioning out of assisted care or into group homes or any kind of situation where maybe their living situation is changing. There's lots of different ways that our role changes depending on who we are and how we're interacting and what kind of ways that we can take this knowledge that we have and apply it to help prevent abuse, support people who've been experiencing abuse, and also to connect people to really high quality, accessible, culturally responsive, trauma informed services. So, what comes next? Like I said, this is a weird one to me. Maybe you all don't feel it and it feels lovely and perfect and I should stop. But to me, this is a hard topic because it's so much background and not a lot of the how to actually have the conversation with someone. So next time when we talk, it's really going to be focused on building connections, and answering questions. So how to have difficult conversations, how to talk about safety, how to ask for help and self-advocacy for people with disabilities who are working with domestic violence providers, how we can advocate for ourselves when maybe the services being offered aren't accessible to us. Um, yeah. So I included some resources. Some of these you all have seen before, but I wanted to highlight this one down here. This is with the Office for Preventing Domestic Violence in New York. And it's a good guide about how to have conversations with folks who are experiencing domestic violence. If you just want some conversation starters, some things to say, some things not to say. I'm also going to talk a lot about that next time, hopefully. So that will be there. If I don't talk about it a lot, I'll make sure I link some more resources similar to this one and including this one that will be helpful. There's also some New Jersey specific organizations and some national organizations that can be helpful. I also have some references if you want to see where I got some of this information. If there's anything that you feel like you didn't get enough information on, please let me know. But otherwise, I am happy to answer any questions you have. Or if there's anything that you want to make sure we talk about in June, I will make note of that and try to make that happen within the kind of 45 minutes to an hour that I have to talk at you in a PowerPoint. Um, yeah, I will just hang out for a little bit as our New Jersey folks close out the webinar. But thank you so much for your time. Again, please email me. My email is down here. If you have any questions, concerns, I really don't care if you just want to ask me like how you should talk to your neighbor because you feel like something weird's going on, or if you need more concrete help on like where you can go for different services. Send those to me and I will make sure that we get those answered for you. And Erin, I will turn it over to you.
Thank you. I just put in the, first of all, Ember, thank you. That was a lot of information. It's such an important topic. So thank you again for doing this series for us. But I did put in the chat two resources, one of mental health hotlines that includes some hotlines that you might need for if you are a survivor of assault. And then also I put in the NAMI crisis resource, which has other information on it as well. And then the resources that Ember put in their slides will be up on our website. So that way you will have all of this information as well. Frankie is putting those slides in the chat right now. She's so fast. Thanks, Frankie. So if you do have any questions you're comfortable asking, feel free at any point to put them in the Q&A or in the chat box. If you have a question you would rather not share with everyone, or if you have something you would like to talk about and you don't want to do it in front of, everybody or put it in the chat for everybody, please reach out to, one of us, either Frankie, Bianca, or myself, or Ember. You have Ember's information. It is in the chat. It is in the slides. And it's important that if you're going through something that you know that there are people out there that you can talk to and you are not alone. So just just reach out if you need anything or if you have any questions. Also, as Ember has stated, the next presentation is going to focus on questions. So in the meantime, if you have any questions that you might want to see addressed, or if you have any interest that you want to see addressed in the next presentation, also please email them to ourselves, Frankie, Bianca, and myself, or to Ember. And I'll just put our email in the chat as well. Excellent. I don't see any questions. That just means Ember explained everything pristinely. Thank you, Ember.
You're welcome. I was doing a pose because I thought I undid my camera and I did it. I was going like this waiting. Thank you. It's really exciting to be able to talk about all of this. And I know it's a lot. And this is a tough one because this is like a real in-between feeling webinar, but we will get some of the nitty-gritty next time and it'll all be on the website. So it'll be there. Thanks.
Excellent. Well, thank you all for joining us today. We had a fantastic group. And again, if you have not seen parts 1 and 2, please go to our website. They are there. And then come back and join us next month for part 4. So thank you, everybody. Thank you, Ember. And I hope everybody has a fantastic rest of their Tuesday. Thank you.
Thank you. Thank you, Bianca and Frankie and Erin. Thanks, everyone. Have a good day.